Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to another episode of the Tech Blog Writer Podcast, gang. As you know, I'm usually a week ahead of my podcast recordings, but in order to catch up after returning from holiday, I'm today recording and editing 5 podcast episode interviews back to back. So I'm going to challenge you all listening now to see if my enthusiasm levels drop over the next few days. But I am going to make a vow to you all now that they won't. Why? Because I'm talking to people all over the world about some of the most exciting and disruptive technology that is quite literally changing the world. And also, I get to talk it directly into your earballs every day. It doesn't get any better than that, does it? Before we begin today's show, I've got to give a big shout out and a huge thank you to Austin in Dakota, who listens to the show every single day and said, Neil, I want to give you a big thank you for helping to make the complex world of blockchain much more sense to him. Thanks so much for your message, Austin. I cannot tell you just how much that means to me, and it's a bit of a nod that I'm doing the right thing, because that's one of the messages that I'm keen to deliver. Speaking of which, today's guest is Marcus Whitney, a Nashville, Tennessee-based investor, entrepreneur, and president of Briovation. He's going to discuss more about blockchain and emerging technology developments in healthcare. As a bit of background, Briovation is a healthcare catalyst and the parent company of Jumpstart Capital, which is seed funding, and Jumpstart Foundry, which is more of a mentor-driven accelerator for healthcare startups, and also the Health Further Festival, which is held in Nashville and takes place in late August, and draws more than 2,500 healthcare leaders, investors and innovators, all focused on driving digital transformation in healthcare. It's an incredibly exciting topic, and the guest is a great guy too. So buckle up and hold on tight as I beam your ears all the way to Nashville so we can speak with Marcus Whitney about using blockchain to drive that digital transformation in healthcare. So a massive warm welcome to the show, Marcus. Can you tell the listeners a little about who you are and what you do?
Well, thank you, Neil. I am an entrepreneur and investor, primarily focused in the healthcare industry. I am a part of a venture fund called Jumpstart, and we have a very, very early stage fund called Jumpstart Foundry with a little over 60 companies in that portfolio. And then we have a sort of more typical venture fund called Jumpstart Capital. That's a $35 million seed and Series A fund. Got 6 investments in that fund. And then I also run a conference, we call it a festival, called Health Further. And we're in our 4th year of that. We expect 2,000 attendees this year. And it's a community of people that are just crazy about healthcare innovation and believe that if we all come together, we can make healthcare better.
Briovation, or Brio for short, is an innovation catalyst. And I believe that you exist to catalyse a revolution in healthcare, all through innovation. But before we delve into your inspirational work, I feel I've got to ask, what put you on this path and what inspired you to make a difference in healthcare with blockchain technology?
Yes, so Briovation is just it is our parent company for all the things that we like to do. We are, we're investors, but we're also entrepreneurs, and so we're constantly sort of creating and evolving our own business model. And so we had to create sort of a top level brand. Sort of like, think about Briovation like Alphabet is to Google, right? I mean, we are infused with innovation. We're constantly looking at new things, and blockchain, is just an incredible innovation that has significant implications on many, many industries. But healthcare, we believe, is an industry where it could have some of the biggest implications possible. So we're very, very excited about it and happy to talk more about how we're approaching that, both as investors and also as innovators.
Excellent. So can you tell me more about blockchain's impact on healthcare, including Briovation's effort to analyse, invest in and provide blockchain technology to healthcare companies nationwide?
Absolutely. So in the U.S., and I have to sort of qualify that, healthcare is not the same all over the world, right? I mean, in the UK, it's sponsored, it's nationwide, but in the United States, it's not, right? So people have they get their insurance either from the government or through an employer, which would be through a private insurance company, or they're out on the market, right? They're on the open market buying it through, the different insurance plans available through the Affordable Care Act. And so because there's such a fragmented market here, there's lots of different ways that things can happen. And all those differences and that fragmentation has created significant inefficiencies in the healthcare system here in the United States. And that has created an opportunity for lots of middlemen to come in and solve those inefficiencies. But what they do is they create significant costs. And so in the United States, we have one of the most expensive healthcare systems in the entire developed world. And unfortunately, the quality of the healthcare that the citizens of the United States receive doesn't match that cost at all. And so blockchain is a technology that has the potential to really remove a lot of these unnecessary middlemen. And that's exciting.
So how do you think that blockchain will enable peers to transact directly with one another, to develop that, optimized, efficient healthcare system, remove their middlemen? And also, could I ask that you expand on how most important peers at Briovation actually view the health economy as the patient and the provider?
I will just say that if you are a patient in the healthcare system in the United States, it's really not a good experience at all. You have your insurance card, and you'll go to the hospital or to the clinic, to see the doctor, and you leave, and you have no idea about what the ultimate costs are going to be to you, right? It's all going to come in the mail, probably 30 to 60 days, sometimes later than that, telling you, hey, here's what you're going to owe from this situation. So it's very, very difficult to know what's going to be covered, what's not going to be covered. And that's just a matter of transparency, right? That's just a matter of systems not being efficient. That's a matter of claims processing being very, very slow and things of that nature. And these are all things that a blockchain could solve for. And let me just take a second to talk about what a blockchain is, right? So blockchain is the underlying technology that made Bitcoin possible. And Bitcoin, which is an innovation created by someone or some group of people under the pseudonym Satoshi Nakamoto, that was a peer-to-peer digital cash system. And the purpose of this peer-to-peer digital cash system was to enable, two individuals or two organizations to make a financial transaction without a third-party intermediary. And that third-party intermediary could be a payment processor, like a PayPal or something like that, right? So this system would allow us to do this transaction without that intermediary. And the key innovation there is blockchain, which is this distributed ledger. And ledger just means, we're tracking all the transactions that are happening, that it works via a network system where there is no trust. And so all of the different systems have to come up with a mechanism for what's called consensus, right? How do we agree that this transaction actually happened? And once we all agree, then it can enter into the ledger. And so, you can think about how many other systems, in addition to a cash transaction system, could use that type of system. Claims processing could use that. Supply chain management could use that. Inventory could use that. So so these are all the types of systems that currently are centralized in the healthcare system. And the companies that provide these services, they charge billions and billions of dollars for these services in aggregate. And if you could remove that, you could remove some friction between the most important people in the healthcare system, which is going to be the patient, provider, and then I would say the people that support the provider in providing healthcare. And you also can speed up that process by lowering the cost, there within. So there's the potential for blockchain to just create a much more functional economy, specifically in the United States. But I do think it could work around the world in many other healthcare systems.
So for anyone listening that are a little unfamiliar with the blockchain space or still trying to get to grips with it all, can you just help people listening visualise that brave new digital world where patients as customers, healthcare providers, and the necessary value-adding services around patient-provider interactions can all transact in a safe, trusted manner without having to rely on third parties or those middlemen that you mentioned?
Yeah, so I think what we're starting to realize is that, these central authorities that manage transactions or that hold all this data, this very, very important data for us, they are very vulnerable to attack. And so in a weird way, they're not quite as secure as we thought they were. I think, most recently what we've dealt with the hacks of both medical records and also credit systems in the United States is really, everyone's data is now out there in the dark web, unfortunately, due to hacks. And so, this idea that, it's important to trust a company to do this because, a more global network couldn't do it, doesn't hold water anymore. We already know we should all just expect that our data, our most personal important data is out there on the internet, unfortunately, because it's already been hacked. And so, a world where we as patients can feel much more empowered that we're operating in a functional marketplace with the providers, with our doctors, where we're exchanging and when we're having a conversation, we're actually transacting and doing business together. And I can understand at the point of service what my costs are going to be. I mean, there's no other thing that we do in America where we don't know what the costs are going to be. Right. I mean, when you buy a house, when you're shopping for groceries, when you're shopping for a car, you never do the transaction and then 90 days later figure out what you actually owe. I mean, this would just be, it would be completely unreasonable. But healthcare is that exception. And we believe that blockchain technology could create the environment where we could have these real time we believe that blockchain technology could create an environment where we could have real-time clarity of what the costs of healthcare are really going to be. Right now, it's almost impossible to figure that out.
Yeah, there is so much excitement in the space at the moment. I mean, as we're recording this, I think Bitcoin's hit $8,000 today. Coinbase are looking at adding another 5 coins. There's just so much movement going on, and there's so many new solutions coming out that are leveraging blockchain. So I've got to ask you to look into your crystal ball a little and ask, how do you think public permissionless blockchains will transform health over the next 10 years to be truly decentralized, customer-centric, and most importantly of all, efficient?
We are so excited, Neil, about public permissionless blockchains. We think that, first of all, it's very, very early. So this feels to us like 1993, 94 of the internet, right? So it's very, very early. Our first investment in the public permissionless blockchain space is in a company called Solaster. And Solaster is focused on creating an interoperability layer and standard, whereby all of these, what they're called distributed apps, all these distributed apps that are public and permissionless, which basically means they're just out there on open blockchains, like Bitcoin, like Ethereum, right? Yeah. Where anyone can sort of, launch them and they can be run and no one has to be responsible for the hosting because they're just running on these large networks. Solaster is partnered with a very high performant blockchain called GoChain. And we're super excited about what this combination offers. GoChain is a fork of Ethereum that performs at 100 times the speed, and it's 1,000 times less costly in terms of what it costs to process a transaction, just because of some ways that they've innovated on the core Ethereum code base. And then Solaster enables multiple different distributed apps that would run on GoChain to be able to share data very, very easily by adhering to the Solaster standard. And so what we see in the future is a proliferation of healthcare applications very, very similar to what you have on the App Store right now on your phone, where, you could have, here's an electronic medical record, here's sort of my personal health stuff, here's my pharmacy benefits. All these different things are now all connected where you own the data and you have sort of a direct line into the value-added partner. So that might be the provider, that might be the pharmacy, but it's you directly engaging with them, all via this interoperable web of technology. And so that's sort of the future we see. We believe it's not in a 2018 or 19 timeframe. There's going to be years of building out this infrastructure, but that's where we are right now. We're in the infrastructure building phase of the public permissionless blockchains, and so we're excited to be involved in it.
And I think another exciting aspect of that infrastructure building time is there's going to be more and more conferences, more and more networking, and people working together to make this a reality. So can you tell me more about the Health Further conference and why you think the time is right for that new type of healthcare conference, and why Nashville is that ideal location?
Absolutely. So many people, I'll sort of work backwards there. Many people don't know that the number one industry in Nashville is healthcare. We're known for country music, and we've had a great show that's been on TV and sort of gone around the world. But healthcare, and specifically hospital systems and behavioral health systems and ambulatory surgical centers, that is the biggest industry in this city. And so where the rubber meets the road for healthcare, actually, delivering healthcare to the citizens of the United States around the country, Nashville controls the largest percentage of for-profit institutions around the country. So it's a great place to hold a gathering around what the future of healthcare is going to look like. And then, there's nothing more important than convening people. And I think that's especially true in this era of, technology, where we're always on, we're always connected. We can message each other, we can share information at lightning speed, but there's still something really important about being able to sit down and exchange ideas face to face. And so that's why every year we bring together these people. And it's a fantastic gathering because it's diverse insofar as the different roles that people play in the industry. We bring together the industry leaders, and these are in established, companies like HCA, which is the largest for-profit hospital operator in America. But then, we also bring together investors, venture investors, angel investors. We bring together clinicians. We'll have over 150 clinicians who are interested in investing and innovation and entrepreneurship. We're partnered with the American Medical Association for the event. We'll be bringing in entrepreneurs and innovators. And so bringing together all these different people with different perspectives and different backgrounds creates, and we believe catalyzes, innovative opportunities that wouldn't be possible otherwise. And so we've now added a blockchain track this year called Tokenizing Health that we think is going to be fantastic for really starting to open up a conversation about these public permissionless blockchains and what they can do in the healthcare industry.
I also attended a conference in Nashville. I think it was in April. And there's a real cool vibe about Nashville at the moment. It really seems to be up and coming, thriving, and going places. There's so many hotels under construction and being put up at the moment, isn't there?
Yeah, we call it Crane City. We are definitely in a very, very serious growth window. Depending on whose stats you believe, there's something between 50 to 100 people moving to the city every day. We've had a complete renaissance when it comes to the hospitality industry here. So sort of a real boom of restaurants, clubs, and bars. As you've already mentioned, we've got something like 2,000 hotel rooms that are going live this year. And we've definitely, blown out the records every year for the last 5 or 6 years from a tourism perspective. So it is a city that's having, sort of a fantastic growth window. And, with that brings some challenges. But, it's an exciting place to be right now.
So what made two Nashville-based healthcare companies team up to highlight and support the innovation efforts that are taking place right across that healthcare industry at the moment?
So Nashville is a very, very collaborative city, and I think that might be the most important ingredient in its growth right now. It's a tremendous honor for us that HCA Healthcare has agreed to be our presenting sponsor for the Health Further Festival for the next 2 years. But it's really just emblematic of what Nashville does, which is, Nashville supports its own. Nashville is focused on its future and is investing in sort of the next generation. And, Briovation, we are sort of that next generation of what the healthcare industry is going to look like. And so we just think this is emblematic of what Nashville is all about, which is collaboration and partnerships.
So is there anything else that you can share with the listeners about your future plans and indeed your vision for Briathon?
Yeah, so I would just say, the most important thing is that, the healthcare industry is a massive industry. In the United States, it is approaching, 20% of our GDP. And the trend that's happening here in the United States of America is happening around the world. As we've globalized and as, corporations have become multinational, we've, along with that, there have been sort of a spread and a proliferation of the challenges, the health challenges. Diabetes is becoming a worldwide epidemic, as an example. And so solving healthcare is going to be one of the most important things for this world that we'll do in the next 25 years. We put that up there with energy and water and food. Solving healthcare and figuring out how to come up with a functional healthcare system that both works for providers and patients, but also works economically. This is one of the most important things we can do in the world. And so we're super excited about the work, and we're going to be going global. I'm looking forward to spending more time in the UK My partner Vic visited London this year. I spent 10 days in Northern Ireland, and so we're excited about collaborating with people around the world to solve the challenges in healthcare.
Well, there is a nice warm pint of beer waiting for you. Next time you come over to London, we'll share one together. But
Sounds fantastic. I look forward to it.
But before I do let you go, could you remind the listeners of where they can find you online and contact a member of your team if they have any questions about the conversation we started today? Absolutely.
So our two biggest brands are Health Further and Jumpstart Foundry. And so I would say on Twitter is a great place to start, at Health Further, and also at JS Foundry is where you can connect with us there. And we'll be regularly posting about our festival, about our different portfolio companies, and just things that we find to be incredibly interesting. So I would say that would be where we would want you to follow. And then if you're looking to connect with me, I'm at Marcus Whitney on all the social networks.
Well, a few moments ago, you did say that right now it's an incredibly exciting space, but it almost feels like 1993, 1994 and the internet, when the internet first arrived on the scene. And that's something that I say a lot as well, because I don't know if you've seen this, but if you go on YouTube and search for Bill Gates, David Letterman appearance, I think it was 1995, Bill Gates went on the Letterman show to talk about the internet and all the exciting things, how it's going to make us more productive, and emails and websites. And everyone in the audience laughed, and everybody, and even David Letterman was mocking him about this internet thing that was coming. And when I talk to people about blockchain and cryptos, it kind of feels the same way, doesn't it?
Oh, it definitely does. I mean, it feels like we're a bit of a heretic. You know what I mean? Being out here sort of pontificating about this blockchain and crypto stuff. But I mean, I think if you understand fundamentally what the technology is, and I think most people don't understand what the technology is.
Yeah.
And I think when you then add that it's going to operate at the speed of the internet, right? I mean, back when Bill Gates was being interviewed by David Letterman, the internet was moving at the speed of telephones, right? And so you can sort of understand how we as people who didn't understand the technology couldn't quite grasp what was going to happen. But blockchain is going to happen at the speed of the internet, right? I mean, it's running on the rails that have been built over the last 25 years. And it's going to move incredibly quickly. And so I think, it seems to me that people are less skeptical of blockchain than I think they were of the internet. But I think also blockchain, rightfully so, has a lot to prove in terms of, maturing as a technology, proving that it is actually going to be that next super disruptive technology. A lot of things have to be figured out, but it's hard to see another technology that's come along in the last 10 years that has the same kind of potential to truly disrupt industries in the way that blockchain does.
Yeah, I couldn't agree more. And also, your point that you made a few moments ago again is about how solving healthcare so it works for everyone is possibly one of the most important things we can do in the world. So I wish you all the luck in doing that. And I'm sure you're going to experience a lot of success, a few challenges along the way, no doubt, as well. But let's stay in touch. And if you have any updates over the next 6 months, year, 2 years, 3 years, look me up anytime. We'll get you back on. But more than anything, just a big thank you for coming on and sharing your story today and your vision.
Neil, thank you so much for having me. It's been a pleasure.
I love the work that Marcus is doing here and his vision on building, like he said, something that is one of the most important things in the world, a healthcare system that works for everyone. Briovation recently announced its new umbrella initiative, which is going to tokenize health, focused on analysing, investing in and providing open source blockchain technology to healthcare companies nationwide to nurture innovation and create unity within this space. And that tokenizing healthcare announcement also includes the public launch of Solaster, Briovation's first healthcare blockchain invention. I think it was also great to hear about blockchain's impact on healthcare and the work that Briovation are doing. But this is not going to happen overnight. But the exciting thing is we're seeing more and more people like Marcus leveraging technology to create a different future and a better world for all. How beautiful is that? For too long, we've seen people complain about anything and everything that is wrong with the world. But technology is now levelling the playing field. It's enabling us all to make a difference and bring meaningful change to the world. And in this case, healthcare. But I want you to be a part of this conversation too. So please, share me your insights, your expertise and your vision on how we can all help build a better future using technology. And you can do that by emailing me at techblogwriter@outlook.com. You can tweet me at Neil C. Hughes or pop by my website, techblogwriter.co.uk. You can leave me a virtual voicemail that we can play on the show too. So a big thank you to Marcus for taking the time to speak with me today, and an even bigger thank you to each and every one of you out there that tune in each day from all over the world. Have no fear, I will return tomorrow and I've got another fantastic guest lined up for you. But until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.